It is a pleasure to welcome you all to the COVID-19 Vaccine Confidence and Mental Health Forum that is presented to you today by TESOC Multicultural Settlement and Community Services in partnership with Scarborough Health Network. My name is Ruksha Sivanandan, and I currently serve as the president of TESOC Multicultural Settlement and Community Services. And it's my pleasure to be the moderator for today's forum. We would like to now commence today's forum with the acknowledgement of the Indigenous traditional territories, for which we would like to request all our attendees to please kindly rise. So the land we are standing on today is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We will also now observe a moment of silence to remember the heroes who sacrificed their lives for Canada, Hamilam, and also remember the innocent civilians across the world who lost their lives due to warfare and natural disasters. Thank you, and please be seated. Thank you all once again for joining today's forum. For those of you who are being newly introduced to our organization of TESOC Multicultural Settlement and Community Services, also commonly referred to as TESOC, I'd like to share with you all a brief overview of the service. I'm just going to kindly ask that if you are not speaking today, for everyone to please kindly mute, just so we can avoid some background noise. So just to start off, to speak about TESOC, TESOC was established in 1978 and was registered as a not-for-profit organization, and ever since has been providing invaluable services to the community. We have 40 multilingual staff members and approximately 30 volunteers. And the main service provided by our organization is settlement services to all newcomers to Canada, irrespective of their country of origin. TESOC services are rendered in more than 13 languages. Additional services provided by TESOC include language instruction for newcomers, also known as LINK, child minding for the children of LINK clients, women assisting women programs, family counseling, translation and basic notary services, mental health and wellness programs, and seniors programs. The implementation of these programs is truly made possible by the funding from the federal, provincial, and municipal levels of government. And as you may be aware, TESOC launched its mental health and wellness program last year to provide members of our community facing mental health issues with counseling, as well as referral services to ensure their healthcare needs are met. And the realities of the pandemic have taken a toll on all of us, physically, mentally, and emotionally. So we strongly feel that creating the best environment for mental health and wellness is now more important than ever. And for this, TESOC has hosted multiple educational seminars and workshops over the past year. Thank you to our team. And they have all focused on educating and empowering the community on mental health issues and building the skills to practice self-care and resilience strategies. So as part of TESOC's mental health and wellness program, today we are very delighted to be hosting this forum in partnership with Scarborough Health Network. As you may be aware, working with many community and government partners, patients, staff, physicians, volunteers and donors, Scarborough Health Network is honestly transforming patient care and outcomes today in order to create a healthier tomorrow. So across 3 hospitals and 8 satellite sites, the hospital has a variety of programs and services that are designed around the needs of one of the most vibrant and diverse communities. And TESOC is very proud of its long-term partnership and association with Scarborough Health Network, and would really like to, at this time, sincerely thank their team in partnering with us today for today's forum on COVID-19 vaccine confidence and mental health. So I think today's forum is very timely, and in terms of focus for today's forum, it will include the safety and efficacy of the COVID-19 vaccine, addressing barriers related to COVID-19 vaccine hesitancy and apprehension, implications for COVID-19 for mental health, and also healthy ways to cope with COVID-19 stress and anxiety. And in order to ensure that we're able to run today's meeting in an effective and efficient manner, we have implemented a few meeting guidelines that we kindly ask that are followed. Please mute your microphone at the lower left corner of your screen when you are not speaking. As mentioned, this will be important in avoiding background noise and distractions for others. Please feel free to turn your video on for the entire meeting if you wish, and ensure that it is in a stable position. This will create a more direct sense of engagement with participants at this forum. And please note that there will be a question and answer period and opportunity for discussion towards the end of today's forum. Please feel free to state your questions in the chat box and which speaker you'd like to direct your question to. If English is not your first language and you prefer to ask your question verbally, there is the option of using the raise hand feature at the bottom center of your screen at any time during the Q&A period. And this will indicate to our team to unmute your microphone and call upon your name for you to speak. Since we have attendees of a diverse multicultural background, we do have members on our team who are also able to translate in up to 13 languages. And we would also like to inform you that we will be recording today's forum and we'll be sharing the recording on our social media platforms. So without further ado, I think we'll step right into listening from our first speaker. It is my pleasure to introduce our first speaker, Dr. Abdel Belhaj. Dr. Belhaj specializes in infection prevention and control, hospital-acquired infections, tuberculosis, and other sexually transmitted diseases, and those related to travel and international health. He also works as a medical microbiologist and medical director of infection prevention and control and antimicrobial stewardship program in Centenary Hospital at Scarborough Health Network. Dr. Belhaj's knowledge, expertise, and contributions throughout the pandemic has been so very integral. So we are very happy to have him join us. So please join me in welcoming Dr. Belhaj to today's forum to speak to us today about his experience as an infection prevention and control specialist throughout the pandemic, and more specifically about the safety and efficacy of the COVID vaccine and how to address barriers related to COVID-19 vaccine hesitancy and apprehension. So I'll now pass it to Dr. Belhaj for his presentation. I'm just going to pull up his presentation right now.
Can you go to the first slide?
Yeah.
Okay, next one, please. Thank you for the introduction. I just want to mention that Scarborough hit hard during the first, second, and third wave with COVID, and you can see on the right side, the dark area in the map, the more cases of COVID. So you can see the east and the west side of the Toronto hit hard. Our assessment center was up to 26 or 27% positivity rate, and it's comparable to the Etobicoke and Peel area. Next slide. All Scarborough considered as a hot zone for COVID. COVID admissions were very high. I believe the highest admission number was 45 across the 3 sites in one day. Intensive care unit and emergency department saw huge numbers. During the peak of the third wave, we were, or during the whole third wave, not just the peak, we were transferring patients all over to the East region. We start transferring patients to Lakeridge, and then to Peterborough, Coburg, Lindsay. Then we went to Belleville, Cornwall, and then up to Ottawa on daily basis. ICU patient and patients who are admitted to the medical floor. Without transferring patient to another hospital, we couldn't function to help our community with the alarming number of COVID cases in Scarborough. Our assessment center now, it's about 8%. If you compare it to the provincial, it's about 3% now. So it's, yes, we see less number of COVID cases now, it's less than 500, but our positivity rate in the assessment center about double the positivity rate across Ontario. Next slide. Yeah, these are this is a snapshot from our dashboard, like from 2 days ago. You can see, we see right now between 2 to 4 cases every day. The number went down. So as I said, the peak was 45 cases. And you can see the trend on the right side of the positivity rate across the, across our assessment center, it's going down to 8%. Next slide. We have 3 assessment centers. In each campus, we have assessment center, and we have one at U of T and Center for Immigration and Community Services. We carried by now over 200,000 COVID tests across Ontario. Beside the assessment center, we had pop-up testing initiative, and we also helped during the peak of the second wave for testing in about 14 nursing homes and more than 100 of schools in Scarborough. Next slide. There are 4 variants of concern. We used to call them the UK, the Brazilian, South African, and the Indian, but because we don't want to put a country name beside, the WHO came in with new nomenclature for them. So the alpha is the UK, and then anyway, the alpha is the UK, which is B117. Beta is the South African. If you hear about gamma is the Brazilian, and the new variant, which is originated in India, we call the Delta. All these variant has a mutation in the spike spike protein, and make them more efficient in transmission. So the transmissibility, it's double or more than double than the wild type of the virus. During the peak of the third wave, the most common circulating variant was the alpha strain, which is B117. It's about 90%. Now it went down to 65, 70%. It's been replaced slowly with the Delta variant. Delta variant is the one on the right side. It's the B1617, which is first identified in October 2020 in India. So we have maybe about 20-25% of the positivity now related to the Delta variant, and we are expecting the number to go up. You can see the type of mutation, the 501, the 484, these are microbiological or PCR target to identify what kind of variant. Right now, the labs start to do about 2,500 samples to be sequencing every week to identify the variant. But as I mentioned, right now, we are seeing replacement of the UK variant with the Indian variant, which is the alpha variant to the Delta variant, slowly start to take over. All these variants, they can cause, next slide, please. So they cause severe infection. They are very easy to transmit and associated with high mortality. And also during the third wave, we noticed more of young people got infected with the variant of concern. And I have seen a family, sometimes the whole family being admitted inside the hospital, all of them because of severe COVID. Next slide. There are two types of COVID vaccine. The ones that are available, the mRNA vaccine, which is Pfizer and Moderna, and the DNA vaccine, it's been put on hold. So Pfizer, it's not, AstraZeneca, it's not available. And Johnson & Johnson, although it's approved by Canada, but it's not being used in Canada. So we'll concentrate on messenger RNA vaccine. Messenger RNA vaccine, it's been available for some time right now. We don't use it for the routine vaccinations because it's very expensive to develop. And also it's expensive to store and to transport. It's been used in the past for a test against HIV, Zika, and probably against Ebola. So what is the mRNA vaccine? It's a sequence of a nucleotide that it will inject through the vaccine. And the messenger RNA goes inside the cytoplasm. It does not go inside the nucleus, so it will not integrate with the human genome. And it carries a recipe, so our body will produce a protein. It looks like the spike protein of the virus. So when this protein released in the cytoplasm, our immune system will fight this protein, will identify it, and will develop antibodies and other immune response to this protein. So if someone gets exposed to the virus, because they have immunity, so the antibodies will attack the virus through the spike protein before it causes severe infection or before it causes any infection. Next slide. The DNA virus is almost the same. It has an adenovirus. It's defective. It does not integrate with the human genome. That DNA will change the mRNA, and that mRNA have the recipe for our body to produce protein. Looks like the spike or protein is of the virus, and the rest is the same. DNA virus, it's more stable, require less temperature to transport and less temperature to store. And as you heard that it's been associated with the blood clot, the risk is very, very rare. Like with AstraZeneca is about, after the first dose, 1 to 60,000. After the second dose, 1 to 1 million. If someone develop COVID infection, the risk of a blood clot, if you require ICU admission, is about 30%. And if you require hospitalization, anywhere between 10 to 20%. It's been put on hold now, and it's not been used, the AstraZeneca vaccine. Next slide. So traditionally, when we develop the vaccine, it takes 10 to 20 years for the approval of the vaccine. So to go first for preclinical stage, and goes then to the phase 1, phase 2, and phase 3. This takes 10 to 20 years. Next slide. And because we are in the middle of the pandemic, we cannot wait for 10 to 20 years. All the vaccines went through the stages as any routine vaccines, but those stages was running together. Before we do one stage and then we move to the second stage, third stage. But because we are in the middle of the pandemic and we need the vaccine right away, so all these stages run together, and the vaccine is very effective and very, very safe. Next slide. These are a summary of the effectiveness of the vaccine against infection. If you can see Moderna and Pfizer about 94, 95%. 2 weeks after the second dose of, again, symptomatic infection. The other vaccines, it's a little bit less, but what I can say, it's like all of them, they are effective, very, very effective, almost 100% against severe infection that require hospitalization, ICU admission, and they are 100% effective against death from the COVID vaccine if you are fully immunized. With the Pfizer vaccine, it's about 80% effective after the first shot and about 95% effective after the second shot. Next slide. So during the third wave, because we hit hard with the third wave, so once we reached the 40% of the population vaccinated, we start to see the cases that require hospitalization declined rapidly. And as you saw in my slide, going from 45 across the 3 sites to 2 to 4 cases every day right now. And if you look to the Ontario, as of yesterday, about 70% of the people who are eligible got vaccinated, and full vaccination is just in about 9%. I'm sure these numbers will change rapidly because the vaccine is available and we are going to give the first and second vaccine and the second shot for a lot of people who are eligible now. Next slide. I just want to give you 2 examples about effectiveness of the vaccine. These are real data. So in UK, because they in early April, they vaccinated about 32 million with 1 shot. And you can see in UK, they did not get the third wave as of us. They have the first wave last year, and they have the second wave between November till April. But when we have the third wave in UK, they don't have it. Next slide. It's the same here. These are Ontario data. The green line is the nursing homes, and the community is the blue. You can see in the blue the first wave, the second wave, and the third wave. Because in December, we want to protect the residents in nursing home. They got the first and second vaccine between December and January. We don't see the third wave in the nursing home. There is no outbreaks in nursing home. There is no mortality as in the first and second wave. While in the community, we saw the third wave because the vaccine, because of the shortage of the vaccine, was not enrolled at that time to the people. But right now, because it's massive vaccination, about 70% being got the first shot, and about 10% got the second shot. So I don't think we're gonna get the 4th wave and the 5th wave. And the only way to prevent future waves by everyone getting the vaccine. In the nursing home, about 97% of the residents fully immunized, and 88% at least got 1 dose, and 66% fully immunized. That's why they don't have a third wave. Next slide. These are the centers that they give the vaccine in Scarborough. There are 5 centers, some of them run by SHN, others run by Toronto Public Health. We have also pop-up clinics that it's been available. You hear about it through our website, through the media. And right now we target anyone who has 12 or older in all Scarborough to get the first shot. And for the second shot, there is criteria that you can see it in our website, including anyone who got the first shot before 18 April, they are eligible to get the second shot now. And if you hear in the news, there is more vaccines being available. So the second shot most likely will be given very quickly. We are not going to wait for the second 16 weeks that initially suggested as an interval because there was a shortage of a vaccine. Right now, the vaccine is available, so everyone will get the second shot soon. 3 weeks, the shortest interval, 3 weeks for Pfizer and 4 weeks for Moderna. Next slide. So this is the website, scarabvaccine.ca. You can go there, you see the eligibility, and if there is any pop-up clinics available in your area. Next slide. We have also a clinic that right now start to see any staff in any nursing home or in any congregate care setting. It will be expanded to the public very soon, and it's called Vax Facts. This is a one-to-one education. It's a vaccine hesitancy clinic that you can have an appointment that being done by the phone. So it's virtually with an expert, and we'll discuss the safety, the effectiveness of the vaccine one-on-one. Once it's available to the public to refer patients there, it's through the website. It's Vax Facts Clinic at shn.ca. The vaccine is effective, it's safe. The Society of Obstetrics and Gynecology of Ontario advised, like they are suggesting for pregnant women and lactating women to get the vaccine. If you are immunocompromised, you still can get the vaccine. The effectiveness of the vaccine, it's not for the one who are immunocompetent, but still it will protect you from getting severe infection and death from the virus. There is a new recommendation will come sooner about interchangeability of the vaccine. So if you get Pfizer right now, you get Pfizer the second shot. If you get Moderna, you can get the Moderna in the second shot. If you got AstraZeneca, you can get either AstraZeneca second shot, or you can get Moderna or Pfizer as a second shot. Other topics that I want to cover that if you get any routine vaccine, you wait for 2 weeks and then you get the COVID vaccine. If you get the COVID vaccine, the second shot, you wait 4 weeks and then you take the routine vaccinations. I try to cover the questions, and those I remember now, but if you have any allergy to eggs or to the antibiotics, it's safe for you to take the vaccine. The only absolute contraindication you have, if you have allergic reaction to the ingredient of the vaccine. If you are in doubt, we can refer you to allergist or immunologist that they can provide a virtual consultation with you. If you have any questions about like specifically about allergy, but the absolute contraindication, if you have allergy to a first shot, or if you have allergy to the ingredient of the vaccine. But if you have just like seasonal allergies or allergies to the antibiotic, you still can get the vaccine. I will stop here, but if there is any questions, I'll be happy to answer after. Thank you.
Thank you so much, Dr. Balhaj, for that presentation, and also really addressing to us about the different vaccine options, as well as COVID vaccine effectiveness, and also the hesitancy and apprehension that surrounds it, and also ensuring that it is safe to get vaccinated. So thank you very much, Dr. Balhaj, for your presentation. Before we go on to our next speaker, I think I'd like to take the opportunity to acknowledge and thank our MP, Ms. Salma Zahid, who has joined us. She's the MP for Scarborough Centre, and she works very closely with TESOC for many years now. So thank you, Salma Zahid, for joining us. We're very honored to have you join today's forum.
Good evening, Wanakam, Ruksha. Thanks for having me here. It's really an honor and pleasure for me to be part of this discussion about vaccine confidence and mental health. So thanks to TESOC for organizing this discussion. Thanks to Dr. Balhaj and Dr. Gunaratnam for being there to answer the questions of the community. I know we hosted Dr. Belhaj for one of our town hall also, and he provided great information. So thanks for providing all the insights into how the vaccine is rolling out here in Scarborough. Getting vaccinated, I think, is really very important. And that's the only thing which will help us get out of this pandemic, and we will be able to go back to our normal life. During normal days, I would go and visit TESOC, meet people there in person. I really miss those events when we had the opportunity to go and visit these organizations and talk to the community members, connect with them, or our office hosting events where people coming. Summer barbecue, which I have been hosting every year, has been always the highlight of the year. Community used to look forward to it, but this is the second year that we can't have events like that. So in order to get back to our normal life, I think it is important that we fully get vaccinated. I myself and my husband, we got our vaccine on April 3rd. My sons have got the first vaccine. I'm really looking forward to getting the second vaccine. I want to encourage the community members to, as soon as your turn comes up, book your appointment. It's a simple process. It takes 5 minutes there. The frontline healthcare workers are really good and they are doing an amazing job. They guide you, get you done, and you are out of that place in half an hour. So get your vaccine and get the vaccine which is available. I know people have a lot of concerns about different vaccines, but the best vaccine is the vaccine which is available for you, which can get into your arm. And as you have seen today, things are, I think, gradually going to start. Government of Canada has said that those who will be fully vaccinated after, I think, first week of July will have the opportunity to travel and not to quarantine in hotel and quarantine for 14 days if they test negative after arrival. So I think these are the things we look forward. So please, don't hesitate to get vaccine. There might be side effects. Every vaccination, every medicine has some side effects, but don't be scared. I think the bigger risk is getting COVID. I and my family got COVID in April. So I know what this is and what a toll it is on your body. I never felt that tired after my chemotherapy, what I felt after COVID. So it's really a big toll on your body. So please don't hesitate to get vaccine. If you have some questions, we have excellent experts available. They will be there to guide you. Thank you, Nandrik, and keep up this good work.
Thank you. Thank you so much for joining us, Salma, today. Your presence and support for us really means a lot. And thank you for sharing some great words of advice regarding COVID and the vaccine. So hopefully we can have an in-person session sometime soon. So thank you.
We will definitely. Take care. Stay safe.
Thank you. You too.
Bye-bye.
Bye. Thank you. And following that, it is now my privilege to introduce our next speaker for today's forum, who is Dr. Sendhuran Gunaratnam. Dr. Gunaratnam works as one of the staff psychiatrists at Scarborough Health Network. He also serves as a lecturer in the Department of Psychiatry at the University of Toronto at present. He is humbled to take the lead role in physician education in the Department of Psychiatry at Scarborough Health Network, and also represents for the Medical Education Committee at the University of Toronto. He is one of the very few Tamil-speaking psychiatrists in Canada and is dedicated in raising awareness in mental health among our Canadian Tamils. Dr. Gunaratnam's service and contributions to the community has been immense in the realm of mental health, and he has undoubtedly opened the door to many integral conversations about mental health, especially for diverse populations in our community. So please join me in welcoming Dr. Gunaratnam to today's forum to speak to us about his experience as a psychiatrist throughout the pandemic, the implications of COVID-19 for mental health, and also healthy ways to cope with COVID-19 stress and anxiety.
Thank you very much. It's an absolute pleasure to be part of this forum today. amazing talk from Dr. Balash about the virus and the vaccines and what to look for, as somebody who has no understanding of what's going on whatsoever and just want to get some information on a nutshell. I guess this is the way to go. I'm happy that I'm part of this forum today, and thanks for the surprise visit, the MPP. Thanks for sharing the personal story, and it's really encouraging for a lot of us to kind of keep the momentum going, no matter what's happening out there. Anyways, I'm Senthuran, one of the psychiatrists at Scarborough Health Network. Some of you might have known me from the recent forums and awareness campaigns that we've been keep creating awareness in mental health, which happens to be a necessity. I just want to start one simple, important question that that I think that it's something that needs to be addressed, and a lot of us needs to hear from an expert point of view. So when people have multiple physical health problems, all the way from diabetes to stroke to cancer, yes, and I'm sure that most of you might have spoken to your family doctor, your specialists, your experts, your family members, Dr. Google, and most of you might have come to conclusion of whether you're a safe candidate for vaccine or not. So that kind of being said, what about mental health? Like somebody have mental health challenges, either diagnosed with mental health challenges and been taking medications and treatment for their mental health issues. Are they safe candidate for vaccines? Anyone could answer my question? Individuals with serious mental health challenges, are they safe? Because the mental health is a serious concern, and the mental health issues happen because of neurochemistry changes, like chemical changes in the brain. So is this vaccine safe for patients who have mental health challenges? Any takers, any volunteers? Not more than one.
No idea.
Okay. So yes, I'm getting some answers personally, which I'm happy about. If you're not sure, I'm glad you're here today. So recently, not recently, a while ago, in England, UK, England, they have done a research on chronic patients with chronic mental health problems, such as schizophrenia. What is the necessity for them to be vaccinated, or do they have to be prioritized to be vaccinated, or so on? And the studies have come across with recommendations, which itself is it's speaking on its own, that the patients with mental health challenges, they should be prioritized for their vaccination. So there are two answers for that question that I have. One, yes, they are safe for vaccination. Two, they should be prioritized to be vaccinated. Why? Why patients with mental health challenges to be prioritized? They're like everybody else, right? They have the people with other issues, other health conditions, healthy people, same as the mental health individuals, like mental health individuals with mental health challenges. Why they have to be prioritized? What's the big deal about them? They're so vulnerable of acquiring the virus because if their mental status is not stable, if they're mentally unstable, the chances of their following up the protocols or the restrictions or the guidelines as a community, as a ruling body or governing body, experts that we implement, it's much less. They're not going to follow up with the standards if they're not in the right mental status. If they're not taking medications on their own, if their mental health is not stable due to the pandemic, due to various impacts from the pandemic, which I'm going to discuss in a bit, the chances of them acquiring the virus and the intensity of the illness that they're going to acquire, or they're going to experience, is going to be much more higher. It's in multitude. the short answer for my question, or the elaboration, is that individuals have mental health challenges, whether they're taking their medications or they're not on medication, regardless. They need to be vaccinated like everybody else. Rather, they need to be vaccinated a bit sooner than everybody else. Of course, the government guidelines here in Canada, we don't prioritize our mental health patients, but at the same time, as a community as a whole, as individuals, as we are, we need to keep this information in our mind. Okay, that's something that it's more of a kind of a bridge from Dr. Balaz's talk from the infectious disease perspective, transferring into the mental health. So why mental health is so a big deal at this point? When that since the pandemic is started, everybody talk about mental health. Everybody talk about burnout. Everybody talk about depression. People talk about anxiety. People talk about domestic violence. People talk about substance use. People talk about suicide. So why is the big deal? Why mental health has been a big deal? So just an example, I know the organization itself that really work with multicultural population with regards to the settlement needs, that it's unfortunate there's an individual belong to my cultural background completed suicide because of his immigration status was declined during the pandemic. Apart from that, there are almost 40 suicidal deaths has happened in our community during the pandemic. There are lots of drug overdoses have happened. There are lots of domestic incidents have happened. There are lots of like worsening of mental health challenges requiring hospitalizations been happening. Frontline workers, healthcare workers, been going through burnout and ended up reaching out for professional help for their mental health, which never been a problem for them. So let's example the virus. Yes, the virus ability to cause lethal damage in our body to the point that death, it's unpredictable and it is scary. But at the same time, how much of patients they are losing their lives because of COVID-19, just the virus itself, or how much of people that they're becoming disabled or distressed by the fear of this virus or COVID-19 pandemic per se. The multitude or the proportion of people going through the mental stress and other social implementations from the pandemic environment other than the direct cause of virus, it's multitude. It's beyond proportion. So that's why we need to talk about the mental health. That's one of the reasons that we need to talk about the mental health. So is COVID-19 causing depression to everybody? No. Is COVID-19 causing anxiety to everybody? Is it causing bipolar? Is it causing schizophrenia? Is it making everybody to drink alcohol and do drugs? Is it causing domestic incidents in everybody's house? No. But if we don't protect our mental health, if you don't pick on the early signs that could trigger a serious mental health outcome or a condition, then we also will be more vulnerable to experience a serious mental health condition because of the pandemic. Simply speaking, that when the brain couldn't handle certain stress, it could be a physiological stress, it could be an infection, it could be a tumor, it could be a mental stress, it could be a financial stress, family stress, chemical imbalance, then the brain started acting weird. And when the brain started acting weird, it varies from individual to individual. It's like a speedometer in your vehicle. Like it fluctuates. Some people, it goes all the way to 100 kilometers per hour. Some people, it stays at 70 kilometers per hour. It's supposed to be 60 kilometers per hour. So it fluctuates based on the fluctuations, based on the severity that that person will be experiencing a negative outcome from their mental health. So we've been using the word called burnout. So the burnout is not a medical terminology. It's not a mental health diagnosis. It's a condition. It's a transient, temporary state of mind, which could be a warning or alarming sign of a future mental health outcome. So the burnout is something like that. Because of the pandemic, it changed our lifestyle. It changed our routine. It changed the way that we socialize. It's changed the way that we interact with our family and friends. It's changed the way in our work life. It has changed our way in terms of our own health routine. Our body has so much of resiliency. Our brain has so much of resiliency. It tries, it's best to buffer or resiliate to an extent. But beyond that, the brain gives up. That's what we call that the burnout or the extreme stress reaction. So what happens that if this pandemic was to be going on maybe a couple of months, maybe 6 months, at maximum 1 year, maybe it was a bit easier to recoup ourselves in a way to get back to the normal routine and kind of get going on with the functionality. But that's not the case. We are just seeing this little bit of glimpse of hope at this point. Things may be getting better, but nobody knows. So this extended period of the ongoing constant stress to the brain, it's making the brain to thrive for certain individuals. And these people are very vulnerable of developing serious mental health conditions. That's why you might have seen that the government has allocated a lot of money for mental health post-pandemic. We are talking about the impacts of COVID-19 on our mental health as an individual and as a society at this point. But the scary part is the negative impact of pandemic post-COVID. Once the COVID is resolved, that is going to be disproportional and scary as well. I'm not trying to scare anybody here. The goal here, I wanted to outline that the post-pandemic can cause another set of negative outcomes, even though the pandemic is over. It's going to haunt us in different ways. Financial crisis, job markets, housing issues, getting back to the routine, universities, migration, immigration issues, health coverage, life expectations, getting back to the routine, trying to pay off the debts, trying to reconnect with families, excessive traveling is all going to cause another form of mental health burnout or even various mental health conditions. So the purpose of me kind of making this more alarmed at this point, to be aware and protect and make those early steps to protect your mental health. So when the pandemic came in, we didn't know this pandemic was going to come. I was at the hospital in January. At the time, nobody talked about pandemic. I was treating a patient from a different country, and then patient had cough as usual. We didn't know January 2020. We didn't know there was pandemic. And then after a week that I really got bad cough, sore throat, muscle aches. I could shakes and shivers. I couldn't even stand on myself. 2 o'clock in the morning, I don't go to the doctor usually. I consider myself as a healthy guy. 2 o'clock in the morning, I drove to the hospital, to the emergency department. One of my colleagues over there, hey, figure it out. I don't know what's going on with me. I didn't know that was COVID at the time. because the COVID was not named as COVID in January 2020. Then after a week that I watched the news, and they were talking about some flu, and then that turned into COVID. So the COVID did not give us any alarms that hit us. We were not prepared, which is unfortunate. But the post-pandemic outcomes, that's something we can be prepared at this point. So we can prevent those negative outcomes that we are going to face after the pandemic is over. There's no magical science here. Nobody needs to buy an expensive COVID protection kit or some tips and manuals at this point. All you have to do, look around yourself who you are, what kind of physical health and mental health conditions you have, look around family, who do you have, and how your relationship with your immediate family members. Make sure that you strengthen your own level of care. That includes your personal care, your exercise routines, your eating habits, your coping skills, your stress management skills, and your medication compliance. There are a lot of people, they take COVID as an excuse for not taking their medications regularly, not going to the pharmacy to fill up their prescriptions, not going to the clinics to get their injections that they're supposed to get for various mental health conditions. I'm just saying, this is the time you need to be extra careful. There are a lot of people, they wanted to skip their routine blood work that they're supposed to do once a year or every 6 months as per their family physicians because it's COVID. I don't want to go to the lab to do the blood test because it's COVID. But you're trying to protect yourself away from COVID, but you're really kind of digging a grave on your own self about your own physical health challenges that might be brewing inside, and you're not testing it as you're supposed to be. There are a lot of people, they skip their specialist appointments. There are a lot of people, unfortunately, they couldn't see their specialists directly because of the COVID. That's so unfortunate, and like we don't have control over certain things, but there are certain things that we have control over, but we take it as granted. So all I'm asking at this point, get back to your routine. Get back to your personal routine, treatment routine, your medication compliance. That's your inner circle. The next circle is your family. Get back to help recoup your family structure, your financial structure, your spouse, your kids, your parents' health. Make sure that you have a plan for the next 6 months of how you're managing the relationship and the structure in your immediate family dynamics. The next step, finances. A lot of people might have lost their job during the pandemic, and they may have to go back to the job. So think about what challenges you have. In that case, you may need support from various organizations. They say for free. They're not charging any money. They're government-funded organizations. They are here to help you. So keep your senses open and open your networks. Have connections with people. Talk to people and keep yourself informed with availabilities and opportunities that you will be needing after the pandemic is over. Otherwise, if you're not prepared, it's going to be lots of competition, lots of rush, and lots of burnout. Lots of frustration, and that could negatively impact your mental health. So your own personal health, your family, your finances, and your social networking. And the pandemic never told us to be socially distanced. The pandemic told us to be physically distanced. There are two different terminologies. Socially distancing is completely different from physically distancing. So during the pandemic, we could still socially engaged in a virtual way, which is obviously not as same as the usual socializations. As the MPP said, the barbecues, I really, really miss those events. But this is what we got for now. Do we have a better choice? No. So after the pandemic, still on the verge of pandemic, if these zones being changing to the positive side, still be mindful, don't rush, don't break the rules, still be a decent citizen, still be mindful about your own health and other people's health. If there's a gathering should be limited to this number of people, stick with that number. There must be a reason. Still, you would be able to happily socialize by maintaining those regulations. In that way, you're protecting your own mental health and also you're preventing the spread of the virus. So the pandemic implications, the family structure have changed, the burnout has happened, people lost job, financial crisis, change in their physical health, change in the relationship patterns, kids staying at home and studying from home. There are parents, they have special needs kids, they need special care, but the care is not properly being provided by virtual classes. It's not easy. And lots of struggles we all had gone through. But at the same time, of course, there are the multicultural community we are very resilient. We came from different cultural backgrounds. We survived the immigration. Now we are, and our generations are growing big time. Our children are in famous universities, and we are positive, we are optimistic of the life that we got in this country, thanks to the mother Canada. But at the same time, we need to make sure that we use this, we recognize this, we respect our sense of resiliency that brought us this far in this country, a completely new environment. We use that resiliency to manage the COVID-19 situation and post-pandemic burnout or post-pandemic rush that we're all going to face. I think I'm going to stop at this point, but I'm sure that there will be specific questions that I'm happy to answer. Thanks for the opportunity.
Thank you so very much, Dr. Gunarthan, for that wonderful presentation and really highlighting to us the implications of COVID-19 for mental health and also some very practical strategies and healthy ways to cope with COVID-19 mental health challenges. So thank you, and we really are honored to have your presence with us today. We will now be moving to our discussion and question and answer period. We kindly ask that both our speakers please turn on their videos at this time. We ask that our attendees please kindly type any questions in the chat box, and if you'd like to direct it specifically to a speaker, please let us know. If English is not your first language and you prefer to ask your question verbally, please use the raise hand feature at the bottom center of your screen at any time you wish to speak, and this will indicate to our team to unmute your microphone and call upon your name to speak. Since we have attendees of a diverse multicultural background, we do have members on our team who are able to translate in up to 13 languages. So I think we'll get started with our first question that we received. And I think I'll direct this to Dr. Belhaj. And this question is it common to have higher pulse after getting the Pfizer vaccine for someone who is aged 50 plus?
Okay, so the side effects of the vaccine, it varies, you know. Some people, they have no side effects at all. Like myself, after the first shot, I have nothing. After the second shot, I got a little bit of pain, sore arm, and that's it. Other people, they may have headache, feeling weak, tired. Yes, fever, rapid heart rate, it may happen, but it's not common. It's very, very uncommon. And it usually lasts 1, maximum 2 days. So in general, we say if your symptoms last more than 2 days, you need to seek medical advice. But the side effects is very, very uncommon. If it's happened, it's only less than 48 hours. Myself, sore arm, probably for 1 day. And we have a lot of attendees, they can share their experience after the second shot. And I will ask Centura to say what's his experience. Did he get the shots?
Yeah, I was vaccinated by the end of January. I was one of the fortunate individuals.
How was your experience?
Because I did not have anything after the first vaccine. The second vaccine, I have some mild soreness, And then I was fine. But again, I guess it's also that the the anxiety that we all have or something, because in the media, people talk about, oh, this is causing that, this is causing that. I mean, every medication has side effects. The psychiatric medications we prescribe, the antipsychotic medications, they have 1% causing stroke. How many patients we see that the patient's developing stroke? I guess that when it comes to the mass media, the negative news will gravitate more focus. But at the same time, it's an individual experience. A lot of people, a lot of healthcare workers, we did not develop any adverse reactions as far as I can speak on their behalf.
Yeah, I mean, we gave almost 300,000 shots, and I'm not aware of any severe reaction. Anyone who get the vaccine, the person will be watched for 15 minutes. If you have any history of allergic reaction, they will watch you for 13 minutes. And as Santoran mentioned, the media always, or the social media always concentrate on the negative news. They don't say anyone who got COVID and require ICU admission, 1 out of 3, almost 1 out of 3, they will get blood clot. But they concentrate after the AstraZeneca vaccine, it's 1 in 60,000. They may get blood clot. It's very, very uncommon. But yeah, tachycardia or rapid heart rate may happen, but it's very, very, very low. Thank you.
Thank you. Thank you for that answer. I hope that answered your question. The next question, so we have some people who have been personally sending us their questions. And the next question is, people with asthma or allergies, can they take the COVID vaccine? And if so, is there a specific one that they should take?
If they have asthma or a general allergic reaction, they can get the vaccine. They can talk to their allergist, but the vaccine is safe with asthma. And the vaccines which are available now, Pfizer and Moderna, both of them has the same efficacy. So both of them will be safe.
Great, thank you. I'll move on to the next question, and maybe I'll direct this to Dr. Gunaratnam. I know you've already done this in your presentation, but what are some additional ways to support your mental health during COVID-19? Any practical strategies that you can share with us?
Sure. Definitely. I mean, it's never ending. So there's no way that a clinician or doctor or family member can give you a script of this is a healthy lifestyle. A healthy lifestyle is something that we should be able to recognize what's good for our own health. But it's not just recognizing, it's more of implementing and sustaining that particular healthy routine in order to achieve or appreciate a favorable outcome. For an example, some people, they think that doing housework is more than enough for their exercise and their healthy lifestyle. But if somebody have a medical condition or even a mental health condition like depression, the normal usual household work may not be enough as an exercise routine. So they may need a routine, a structured form of exercise, a structured, more aggravated form of eating habits or stress management strategies that should be sustainable. So during this pandemic, how to cope, I would say that especially that the young adults and even seniors, this is like we happen to be more flexible or less mindful of our daily lifestyle, because during the pandemic there's nothing much to do, there's nowhere to go, so just kind of sitting and watching TV or laying down, that's not good. And there are a lot of people that I have seen that they wake up at the television, the news channel, and they go to bed with the news channel. Even some while ago, the World Health Organization has recommended in terms of that news watching timeline. They say, please don't watch the news as soon as you wake up, because the news is going to tell you about the numbers. The news is going to talk about the zones. The news is going to talk about deaths and accidents and crashes. And then you're going to wake up with that negative message. It's going to negatively impact your brain. So wake up with something nice. Wake up with something that you will be excited to. It's a loved one smile, or to a nice music or comedy that you like, or nice sunshine, or nice cup of tea. Whatever it is, wake up with something that you would enjoy, not with the news. The second one, that don't go to bed by watching the news. There are a lot of people have sleep problem, not because of they have an underlying sleep disorder, but because of they have this procrastination before bedtime. There are a lot of people, this happen to shut down their brain naturally before bedtime. That's the time, I think I can speak of my patients, that's the time they switch on their brain before you go to bed. Bedtime is not the time that you think about the whole world of problems that you have. If you really have, I'm not minimizing the stress and anxiety we all been going through. I can sense it. I feel it by myself, and I hear from my patients and my families. The technique for that I would say that is, again, there's no script. These things would work for other people, so it should work for you. Then have a worry time. If you're really going through lots of stress in the family and finances and physical health and so on, have a worry time. Say 4 o'clock in the afternoon is your worry time. Prior to that day, the entire day, whatever the thoughts and concerns and worries that's bothering you constantly, put it in writing and keep it reserved for the afternoon worry time. And in that way, you wouldn't be worrying too much. That wouldn't affect your sleep routine. That wouldn't negatively impact your daytime. So have a structure. Imagine, pretend you're on an active routine. You're going to work. You're doing productive. Don't just relax yourself or like lack yourself that because there's nothing better to do outside. I guess that's the simplest way that I could say to somebody, an individual, without knowing their condition, age, diagnosis, medical condition, life expectations. Anybody should maintain a simple structure and a routine that should be for them to so easy to transition as soon as the pandemic is over. So please be mindful. Don't take it too granted.
Thank you. That's a great answer. So I think we have questions pouring in, and we have about 15 plus questions, but we won't unfortunately be able to get through them all, but we will email you back with your responses after consulting our experts. But I think we'll take one more question that was in the chat box from today. And the question is, my mom had numb hands the night after her vaccine. It was okay after she massaged it? Is this something that's normal? So maybe Dr. Belhaj, I'll direct this question to you.
I mean, as I said, local reactions may happen, like numb hands, it may be a local reactions to the vaccine. So it may happen, it's self-limiting, it will go away by itself.
Wonderful. Thank you for that answer. So thank you everyone for participating in today's Q&A session. Just due to time constraints, we won't be able to get to all the questions today, but we will email you back with your answers as soon as we can. And thank you once again to everyone who participated in today's forum. That brings us to the end of today's forum on COVID-19 vaccine confidence and mental health. We hope you all found academic and personal perspectives presented by our distinct physicians from the Scarborough Health Network helpful and informative. And on behalf of TESOC, we'd like to express our sincere gratitude and thanks to Dr. Abdul Belhaj and Dr. Sendhuran Gunaratnam in taking out time from their extremely busy schedules in order to participate as guest speakers in today's forum, sharing their knowledge, insights, and experiences with us, and also educating our community during a time of such great need. So thank you very much. We would also like to take this opportunity to thank Ms. Seema Khan, who is the lead for health equity, patient and community engagement, strategy and transformation at Scarborough Health Network, for really all her assistance in organizing today's forum in such an efficient manner. TESOC is really proud of its continuing partnership with Scarborough Health Network, and And we really hope that we can continue to build in and strengthen this partnership in the future. Our organization is also very fortunate in having an efficient and dedicated team of staff members who relentlessly strive to provide excellent services to our clients. So despite the impact of a pandemic, they really remain focused on delivering such exceptional, compassionate, and quality care for the community. So I thank them with gratitude for their ongoing commitment and dedication despite the challenging times. And special thanks to our Executive Director, Mr. Mohan Ramakrishnan, for his leadership, and our staff members for their attention to detail in organizing today's forum. And also thanks to our Board of Directors who definitely play an invaluable role in supporting our organization, and also, of course, our members who attended today's forum, and we definitely hope to have their continued support. We hope today's forum informed you about the safety and efficacy of the COVID-19 vaccine, how to address barriers related to COVID vaccine hesitancy and apprehension, implications of COVID-19 for mental health, and healthy ways to cope with COVID-19 stress and anxiety. So thank you all once again for joining today's forum. TESOC is very humbled to have your support as it grows its mental health and wellness program. And as an organization that continues to grow, we are very grateful for all the feedback and insights that you have shared with us, and we request your participation and collaboration in the future. So thank you all, and hope you all have a nice rest of the day.
Dr. Sendran, is it possible to get your contact? Is it gone?
I think the question
Is it possible to get the contact? I want to talk about one of the client matter with the mental health and some other things. So I'll get from Ruksha then. I'm Bhavani here.
Yeah,
Thank you.
I guess they have my email address. Absolutely. Please go ahead.
That will be great. Thank you.
No problem. Have a good day, everyone.
Thank you so much.
Okay, bye.
Thank you all. Thanks, everybody.
Thank you so much.